Thank you for the possibility to talk here. If you have more interest, we have a booth here nearby. I will tell you a little bit about the flagship project ScanBalt Health Region, driving cross-sectoral innovation in health and life sciences. If you are not able to follow, we can give you a copy of that at our booth. So where is the... okay. Just the background, I don't know whether you know the activities in the healthcare sector. This has changed pretty much, paradigm shift in the last years. We are talking about health not only as a cost factor, but as a driver for economy, not only as a driver for economy, but also as securing the employment. Around 5 million employees in healthcare and healthcare-related industries are employed in the Baltic Sea region. We have a lot of universities, a lot of scientific institutions there, and we have a very high density of small and medium-sized companies in the field of healthcare, pharma, medtech, and also related to that with an environmental focus. So we are ScanBalt, we are a member-based organization representing these different networks around the Baltic Sea region. We have recently, in the framework of this flagship project, done an analysis together with Nord LB, that's a large financing institution, and have summarized the trends in the healthcare sector. So they assume that the strong growth of the healthcare sector will remain. It will even be stronger with respect to internationalization. It will increase, it will lead to increase in employment. And so we also will face some challenges there with respect to skilled labor force. The healthcare systems are going to converge and become more similar, of course, always on the background of the different regional settings. We have still some remarkable differences in the health status, and that's one major goal of the activities, to bring this to one level with respect to life expectation, health satisfaction and mortality. And what is very important, we have joint challenges in innovation. So we have large pandemic challenges like diabetes, dementia and oncology in all our regions, be it the western or the eastern regions, be it the metropolitan areas or the rural areas. So what have we done? We have analyzed the situation. We are talking with researchers, we are talking with the companies. So our goal is to promote the companies, to promote commercialization. We are talking, for example, with the healthcare providers. What we realize, we have different worlds, we have different actors, different sectors in different regions, but all of them face similar challenges. And these are somehow the basic bullet points which came out where we have to put our efforts in the future in promoting innovation. And I want to say this is not only innovation in the technological field, this is also in the field of social innovation or service innovation. Scouting and early evaluation, regulation and procurement, business support and financing, implementation and marketing, education and qualification. And just a few examples. All is analyzed here. This is my colleague who does presently another presentation at the NDPHS workshop. Especially in the field of healthcare, we are convinced that we need a very severe kind of whole aspect complementing system of innovation, so what we call an innovation ecosystem, where we recommend measures in these different areas which I just mentioned. So the key recommendation is to promote this multidimensional innovation ecosystem for health economy in order to obtain self-sustainable companies in the region and in order to help the existing companies. What have we done and what should be also continued? These are now 3 examples. One is from our Finnish colleagues. They have launched an instrument, they have launched an international innovation competition looking for new ideas, not only from the research labs, but also from the hospitals, from the healthcare providers, from the general practitioners. And we were very happy to identify in the last 2 years 4 prize winners, which are now getting hand-on support. For example, 2 nurses out of the IDEA clinics from northern Denmark get real support in founding their company in a very sophisticated and very smart new device. And they get the support on a transnational scale, so with the colleagues from Gothenburg, but also with the colleagues from Culminatum and Science Park in Finland. Example 1. Example 2, education and qualification. This is a hotspot of our activities. I think also one main qualification of the Baltic Sea region. There, our colleagues in Gothenburg have set up an educational platform, especially suited for entrepreneurial training. Here is an example in the field of regulation and procurement. Clinical trials play an essential role, and the first course was initiated January 2013. There are other courses in planning, very hands-on, very easy to reach, and Gothenburg University also looking for not only customers but also for partners for this platform. Last example is a new platform for business support and financing. This was set up by our colleagues in Estonia, Denmark, I think it's Latvia, and also Sweden, where they have arranged a program to mentor new ideas, to develop them, to support them with some sophisticated business support toolbox with experienced people, former experts working at large pharmaceutical companies or medtech companies. This is a hands-on support. This is very much driven by our colleagues in Estonia. They want to develop an Baltic Scandinavian accelerator for health science startups, and they are going now to find money for it. So the regions will put money for it into this fund. It's a one-year course project where individual startups can be mentored and get money out of it. So this will be a real further step in helping these companies into the market. I think that was it. I hope even to have saved some minutes. If you want to come to a next meeting, we are meeting regularly. Our next meeting will be ScanBalt Forum 2014 in Groningen. Thank you.